acute hydrophilic polymer neuropathy, and acute renal failure. Definition: hydraulic coating are used on intravascular devices to facilitate manipulation and to minimize complications such as vapospasm during a procedure and thrombosis after flooding.
Kidney failure can lead to heart failure, and the symptoms of kidney problems aren't always clear-cut. News 13's Jessica Foster looks at the warning signs and advancements in treatment in tonight's Modern Medicine Report.
Kidney failure is a serious condition, but patients can recover and go on to lead a normal life. The key is early detection and treatment.
We get kidneys shut down, we get fluid that builds up, and we get those toxins that build up in the body. One of the problems when the toxins build up is it affects our brain, it affects our heart, it affects all organs of the body.
Nephrologist Dr. Todd Minga says kidneys not only remove toxins, but also maintain the fluids we need. He says the best prevention is early recognition of risk factors. Diabetes, high blood pressure, the use of non-steroidal anti-inflammatory drugs, and certain over-the-counter medications can lead to kidney problems.
One of the most important ways that we treat kidney failure that's not amenable to conservative treatment is through dialysis. And most people know dialysis as a chronic treatment outside the hospital. But more importantly for us in the hospital, those people who may suffer from acute kidney injury can receive a life-saving procedure such as dialysis, which is responsible for removing those extra fluids and removing those toxins until the kidneys can recover.
The dialysis machine simulates kidney function.
A kidney has blood vessels, a kidney has a filter, and that process helps remove the toxins in the fluid.
The machine also monitors a patient's heart rate, vital signs, and calculates how much fluid and toxins are removed.
But the goal is not to fix the kidneys with the machine, but to support the body until the kidney function returns.
Dr. Minga says treatment can last for 24 hours to weeks or months, depending on the severity. Symptoms to watch for include swelling, shortness of breath, confusion, and just feeling bad in general. However, the symptoms aren't always clear-cut.
Application in medicine. The patient underwent renal transplantation in weeks. The renal artery was implanted into right external iliac artery between January and June 2030. Her serum creatinine level increased progressively over a 5-month period. Pros: polymer coating intervention devices are used frequently, and the diagnosis of polymer emboli is unlikely. Since emboli usually lodge in the arterioles of downstream organs.
Acute kidney failure is an emergency, and this is the condition where the kidneys stop working or they stop filtering the waste products from the body, from the blood within few days or less than few days. So as a result, when the kidneys stop working, it has severe complications. It can cause the fluid buildup in the body. It can cause the chest pain. It can cause the muscle weakness. It can cause the permanent kidney damage and even death. So when we are talking about the fluid buildup, in the acute kidney failure may lead to the fluid buildup of the fluids in your legs, which can cause the shortness of breath. which can cause the swelling. And if it happens in the lungs, it can cause shortness of breath. If the lining that covers your heart, which is known as pericardium, if it becomes inflamed, you may experience chest pain. And if your body's fluids and electrolytes are out of balance, you may feel a weakness in the muscles. And, it causes a permanent loss of the kidney function or the end-stage renal disease. And the people with end-stage renal disease require either permanent dialysis or maybe the kidney transplant to survive. And if you fail to manage these, the death can happen. Thank you.
Conclusion. In conclusion, the current case highlight what we consider to be an underrecognized iatrogenic complication. Embolic material may be present in patients who have undergone recent implantation of an intravascular device with a hydraulic coating. Thank you.